The scope of my speak today will be about its five part. The first is science. See, because I think we should begin understand what is science and how those science influence our nursing science and nursing ontology and epistemology. That is the pattern of knowing, which is the original work of Dr. Carper, who analyzed our foundation of knowledge that we use in clinical practice. And then when talking about nursing science, the nature, development, and progression, and the role of theories or model in nursing research. And then, an example of nursing research. So let's begin with science. And this, that physical, chemistry, biology, those kind of fields, this is, we understand that these are science. But music, art, and religious are not science. So when we call science, then how about psychological and sociological science? Okay? Because in Thai, we translate science as Vidyasat, just only natural science. It doesn't include psychological and sociological science. Okay, I don't know, in other language in your own country, how people understand about science. But in Thailand, science was translated as only natural science. So science, or I call it SAP in Thai, okay, composed of substance and method, both substance and method. Substance is the content, the theory, the knowledge of nursing science, which emerged from the ontology, or, the nature of reality in nursing that we are seeking to develop knowledge. And the method is how we know our science. That's the research method. Okay. So science divided into three major fields: natural or hard science, soft and applied science, and human science. For natural and hard science, the outcome is the body of knowledge. We are going to build the theories, such as physics, chemistry, biology are an example of natural hard science. So, hard science beginning with the law of nature. That is the law of physical world, or empirical truth, or of great generality. I think you learned this in philosophy of science. Or we call it physical science or pure science. Pure science is a unique body of knowledge, independent of others, able to stand alone, not pursue for its utility. Okay, that's the purpose of natural hard science. The utility will come after. For example, those technology, usually they must have a very strong hard science to build on the technology. But their purpose is not utility. And their ontology, or their assumption, they believe that in reality, realism, reality is objective, is consistent and producible and reliable. So there is a reality and a single reality. Human beings have the capacity to accurate in their objectivity. That's why in doing natural or hard science research. The methodology is very rigorous and must be accurate because the belief or the assumption, they have the assumption. And our human being has the capacity to be accurate in their objectivity. I think from philosophy of science, you know about people. We learn things from our experience, five sense experience, okay? And that means that we believe in our sense, our experience. Our sense is accurate, okay? That is objectivity. As consequent, explanation are reasonable, consistently accurate, objective, discoverable, and understandable. Okay, these are the assumptions. The belief that there is an external world, structured independently of self, that is grounded in reality. It means that there is a reality. Okay, the external world, there is the reality, and it's dependent of self. We, our experience, do not influence that reality. People will see the same thing. Okay. Example of physical science in health, such as biophysical, biochemistry, pathophysiological process in health and illness, omic, which refer to genetic, proteomic, and microbiomic area, etc. This is an example of physical science or hard science. So, assumption of scientific method for the physical science is observable is universal. We use sense, we use observable, and the observable is universal, meaning that people see things the same. All essence are the same. The individual do not apply. Your experience do not apply, do not influence the reality. The law guides every action. The outcome of experiment is useful in predict and control. We want to understand the phenomena, and we want to understand why things happen, because we want to control, to make the outcome desirable to us. Okay. The natural world, structured independently from human consciousness, the natural world, the outer world, was structured independent from human consciousness. Okay. So objectivity and value neutral. Value neutral means that your value, your belief do not influence what you see. So the aim of natural science is single aim, to search for the truth. And single truth approach on the belief that objective world exists independently from consciousness. No theory-laden observation. So this terminology you may see quite often in reading related to philosophy. No theory-laden observation. I don't know whether you believe in it. Okay. Sometimes, when we learn some theory, we tend to see things according to the theory that we have learned. But the natural science said that the reality exists independently, no theory-laden observation. The aim is to describe and explain the external world of the ultimate goal. And the ultimate goal is to control that phenomena. That's the aim of natural science. The next science is soft and applied science, soft applied science. Soft applied science doesn't mean that you just only apply knowledge. They have a unique body of knowledge too. And they focus, but their knowledge focus on apply related knowledge to meet some human needs. not only generate knowledge for the sake of knowledge. Apply means in the process of develop their own knowledge. Applied scientists use the knowledge from pure science. For example, sociologists generate knowledge or theory of social cognitive learning theory. I think nurses use a lot of social cognitive learning theory to understand how people think, to control the behavior. But sociologists, they build this theory on pure science, that is brain learning. That's why, they think that if people keep doing the same thing or exercise for 6 months, then the brain will learn. And then they can, accommodate that behavior. But pure scientists do not build knowledge from applied science. Okay? And the aim of applied science is the application of knowledge for a specific purpose, not focus on generation of knowledge for the sake of knowledge, but for the development of application that can better situation process or change the situation that they apply science. The third one is human science, not soft or hard science. It is different. This type of science was introduced by Linde. He's a German philosopher in 1900. He concerned about the focus of objectivity and value-free of hard science, which left the person out of the process. See, in hard science, when they do experiment research, or they did research, they try to control everything, okay? Or in the experimental research, if they want to know whether the intervention is effective, randomized control trial is the best. They have to control everything. Okay? That's Dr. Linde believe that. They left the person out of the process because they eliminate confounding variables. Okay? And knowledge base not include the everyday lived reality of individuals. Human science capture human beings and their experience as the source of knowledge. Okay. You can see that those people in qualitative research, when they conduct research, what they are doing, they respect the participant, and the participants provide their experience and understanding, and the data or the outcome is the experience of those participants. It's different from hard science. Scientists become as much a part of experience as does the participants. Human science, they believe in value-laden observation. They accept that observation, what people see, their value has the role. So it's not value-free. Value and experience of people influence what they saw, what they understood. And that's why human science, they didn't believe in reality. They say that it's idealism. So the reality is constructed. So there are many truths. It depends on the participants. So cognition, perception, and experience affect what is still seen or conceptualized. And the aim of human science, They focus on individual, family, and communities to improve quality of life, to ensure dignity at the beginning and end of life, uncovering the meaning in everyday life, highlight the role of individual within this examination. Simply state that to know and understand what works for people, to maximize their ability to fully functioning individual, family, and community at whatever level they are able to function. So, scientific method of human science is varied methods are used. Researchers and participants are at equal status. This is opposite to the hard science. Hard science, the researcher has a higher status than the participant or the sample. And from the language, you can see that those hard science, they call the sample is the subject, okay? Even the language, they call subject, but for human science, they call participants, not subject, okay? Okay. Researcher and participant are at equal status. They share experiences, feelings, and perspective. Method not linear, like a hard science, nor constant, but dynamic and still made rigorous in terms of context. Okay. Those who conduct research using qualitative method, the context is very important. VS, randomized control trial, validity, reliability, we control everything. Some, they even do their research in the laboratory, okay, because they want to try to control extraneous variables that may influence the outcome. So that raises the question of, when we want to use knowledge, usually in our nursing science, we want to use with people, not in the laboratory. The aim is to understand inner side of participants, not to control. That's the aim is different. So usually they use qualitative method. We have a little of natural hard science, not little, I think. We have a very strong foundation in that hard science. And even some countries, they admit the nursing student from science and technology field, not human science field, right? Because they have to learn about those theory, those knowledge in health science. And how about applied science? We are applied science. We build knowledge from the hard science. And our purpose is to use knowledge. We do not build knowledge just the sake of knowing, but we want to apply to people. And how about human science? Nurses must understand people. Even though we use hard science, but we need to understand people. And understand people is the core value of our profession. Why our profession is caring, we call it caring profession, or passionate, is very important for nurses. So let's look at that the epistemology and ontology of nursing science from the pattern of knowing in nursing, which was published, was studied by Dr. Carper, She studied this while she was a doctoral student in it and published in 1978. And her question is, what knowledge that nurses use in practice? What kind of knowledge nurses use in practice? So her paper, the name of her paper is Pattern of Knowing in Nursing. But if you read it, you feel, very a little bit confusing, not very confusing. I read it first, I was confused because I expect to see knowing in nursing, that is the epistemology. However, when reading it, I think it's a little bit emphasized on ontology, not really the epistemology. But anyway, maybe it's combination, but I think mostly ontology. See, what is nursing science? The definition I propose must be broad enough to encompass on disciplinary knowledge and cannot focus on only one paradigm, nor can the primary focus be on the activity of our science, such as theory, development, and research. Rather, the essential focus is on knowledge. Okay, this is by Elizabeth. She talked about, nursing science. And from Harvard, she said, it is the general conception of any field of inquiry that ultimately determine the kinds of knowledge that field aims to develop. That is the knowledge that we nurses are to develop, as well as the manner in which that knowledge is to be organized, tested, and applied. Such an understanding involves critical attention to the question of what it means to know and what kind of knowledge are held to be for most value in our disciplines of nursing. So I feel that her paper is both, not just only knowing or epistemology, but it includes ontology too. And this is her finding, which I think, many people get developing from her idea. But her original idea is she called it for pattern of knowing. And that for pattern is, the first one is the empiric. Okay, this is the model. I will go in detail, in each pattern of knowing, but try to understand this figure. You can see that when, she wrote it, it looked like separate pattern, but really it interrelated. This pattern for pattern of knowing, empirics, personal knowledge, aesthetics, and ethics. So the line between pattern is a dot line. That means, it's all related. Okay. And this model shows the outcome of using the pattern of knowledge and the knowledge or the theories from that pattern. For example, if you use empiric knowledge, that's scientific competence, you must have a scientific competence. If you use personal, that the competence is therapeutic use of self, or aesthetics, that arts or act, and ethics. Okay, that's moral, ethical component. And people keep adding many patterns now. You can go back and see, maybe right now there are so many. And you will get a sense that nursing is not just only based on natural science or hard science. There are another pattern of knowing at that beginning. And that at that time, we don't know about qualitative method. See, at that time, we use research method from based on general research method, and usually it's a hard science method. So the first pattern is the empiric or the science of nursing. This is the knowledge about the empirical world. Empiric is based on the assumption that what is known is accessible through sense, seeing, touching, hearing, tasting, smelling. So the ontology is the realism. We believe in realism. That's the empiric. Nightingale was a good empiricism, as she emphasized the importance of accurate observation and record keeping. See, her theory comes from her observation that the soldiers die in the war after operation. And she tried to find, what is the cause, that cause and effect. And she found that sanitation, those environments that that is not good, not sad, not it's dirty, those kind of things that make soldier die. And during that time, there's no antibiotic. Okay, so that she used empirical observation and she emphasized, and that's why her theory influenced our practice. We keep cleaning in the old days. Nurses must, clean everything, give a good environment, because she believed that good environment is very necessary for healing. Okay. And observation and record keeping, you can see Florence Nightingale with the lamps. Knowledge that is systematically organized into theories for the purpose of describing, explaining, and predicting phenomena of special concern to the discipline of nursing. Reality is viewed as something can be known by observation and verified by others. It's expressed in practice through the nurse scientific competence, action grounded in scientific theory, cognitive components of problem solving, and logical reasoning. Use evidence-based practice, that is the inductive. The evidence-based practice were, those research was studied. And we summarize those research findings to apply to other settings and to the future, into the future, that we use inductive reasoning to base our practice. Empiric knowledge are the empiric theories, model, statement, description of empiric event or object, including evidence-based practice. Empiric method, the method of science, we test hypotheses derived from a theory that offer tentative explanation of the empirical phenomena. The expression of knowledge used is scientific competent. Now, do you think that we need that empiric knowledge? I think everyone, yes, we need that. And I think we need a lot. We try to build a theory, or we test the theory that come from other disciplines, whether it can be fit with the nursing phenomena. So we use theory. We use those in education. Otherwise, what we can use to teach our students? However, that is not just only one pattern. The second pattern is aesthetic pattern of knowing, or the art of nursing. Involve deep appreciation of the meaning of the situation. Empathy, the capacity for participation in or vicariously experiencing another feeling, is the important mode of aesthetic pattern of knowing. And this is in Thai we call silapa. If you know empiric knowledge, when you take care of the people, you have aesthetic, you understand them. So the way you apply the empirical knowledge is different, right? Because you understand their pain. The interaction between nurses and the patient, the compassion, those kind of things will come with aesthetic pattern of knowing. The more skilled the nurses become the perceiving and empathizing with the lives of mother, the more knowledge or understanding will be gained of alternate modes of perceiving reality. So the ontology is, for this pattern, is idealism. See, for aesthetic, it's not a single truth. It depends on the value of the patients and the nurse and the other all stakeholders. And at that time, we don't have qualitative method, but nurses use this in their practice. And we teach the student, but we don't have any known theory. But we emphasize about this for nursing students. So nurses' experience means experience in working with the person who directly encounter with that phenomena, but they should have a capacity for participating. That's, nurse use interaction theories to interact with human beings. Aesthetic expression of knowledge, action, bearing, conduct, attitude, narrative. Okay, this is the knowledge of expression of knowledge. Interaction of the nurse with the others, individualized care in art form. Sometimes, some nurses are very good in poetry, drawing, story, and music that reflect the communicate symbolic meaning embedded in nursing practice. There are many nurses that use poetry to communicate about, how we care for patients. Okay. Aesthetic method of knowing. What does this mean? How is its significance? Envisioning or imagination or rehearsing. The third pattern is personal knowledge. The most problematic and most difficult to master and to teach. Concern the inner experience of becoming a whole, aware, genuine of self. Encompassing knowing one's own self and the self of others. Nurses must learn to empathize the patients and their family as they face difficult illness or injuries. Carver encouraged nurses to put themselves in the patient's shoes so they will have the sensitivity and awareness to address not only physical needs, but mental and emotional ones too. Personal knowing is the understanding and actualization of the relationship between a nurse and the patients. The method of knowing In this pattern, personal reflection and experience the phenomena. Okay. Personal reflection. When you teach the student, for example, if your student cry when the patient dies, you really need to sit with them and reflect their experience. This is the kind of method of knowing. And this will teach them how to know not just only the patients and the family, but herself too. Right? I mean the students too. That, they share experience with the families and the patients. Passionate participation in the act of knowing. So they use qualitative research approach. This comes from the knowledge, from the qualitative. When you read those qualitative knowledge, you will get the sense that, those knowledge make you understand the patient's cognition, their perception, their experience, their belief, their difficulty, and so on. And if you know that, what is the useful for that knowledge? Because those qualitative people, they think that the aim of qualitative is not generalization. The aim is to understand people. And if you understand people, then you can use this process to approach the other patient, not use the old knowledge or theory to justify people. So if you have this in mind from the qualitative, then you understand people. So when you provide care for individualized patients, your intervention is individualized. Okay. And I think nurses must know themselves too. You know about your value, your belief. Because when we interact with people, that values and beliefs affect what we do. Okay. Method of knowing, personal reflection and experience of the phenomena, passionate participation in the act of knowing, okay, qualitative research method, and understanding human experience. So the ontology is idealism. Personal knowledge, a form of knowledge, story that we write a case study, genuine self, case study from client perspective, qualitative study. The expression of personal knowledge, when you use this knowledge, that use the therapeutic use of self, the way in which nurses view their own selves and the client is of primary concern in any therapeutic relationship. Involve interaction, relationship, and transaction between the nurse and the patient's clients. The fourth one, the last one, is the aesthetic pattern of knowing, or the moral component. Focus on method of application of what ought to be done. Goes beyond knowledge of the norms or ethical code of nursing. It involves making moment-to-moment judgment about what ought to be done and what is good and right and what is responsible. Ethical knowing guide and direct how nurses conduct their practice. What they select as important, where loyalties are placed, and what priorities demand advocacy. The method of knowing: dialogue, justification, value clarification, and you can see that this method is not the objectivity that is different from hard science, the form of knowledge. Moral, ethical component, nursing action. Oh, this is the knowledge expression. Ethical component, nursing action can be observed by others, and underlying reason can be examined. Okay. So that's for pattern of knowing. And you can see that Dr. Carver, she laid a very strong background for our nursing science, both substance or knowledge or theory or model. That's the ontology, the nature of our nursing reality, and the method. So, what do you think when we talk about hard science, applied science, and human science? What kind of science? What kind of nursing science? What type? See, we nurses here in Thailand, nursing field is classified into science and technology. Because in Thailand, there are two categories in classification of knowledge. The first one is science and technology, and the second one is humanities. Humanities, social science. We are in science and technology. And many faculty ask me, we should be in human science. Why? Why we are in science and technology? We are both science and art, right? We are both science and art, but our category is on science and technology. So let's see, what is the nature of nursing science? Nursing science is the science of health. This is just beginning in 2003. See, in order to establish PhD program, you must clarify what is the unique knowledge that you are going to conduct research. So you have to understand what is nursing science about. Otherwise, how we can conduct research, because we don't know the ontology or the knowledge or the theories in our field. So we define nursing science is the science of health at the first beginning, so that we can get PhD program start. We are going to do research on health. Nursing science concerned with promotion, maintenance, and restoration of health in human beings. Promotion of good death at the end of life. ICN added in 2020 about promotion of good death. Nursing science overlap with biological, behavior, and social science at level from molecular to society, considered in context and over time. I think this is a very good summary of the nature of nursing science. It's overlap with biological. The patient won't save if we don't have those health science knowledge, okay, we need to understand the behavior and social science, okay, and see our individualized, our philosophy of individualized care. We understand individual from the molecular to society. That means that even the genome or genomic right now, we need to understand because those genomic interaction with the environment and the behavior to cause the illness, the sickness, or the disease. And, treatment right now, genetic or target therapy is very important. And there are many phenomena that related to genome. But we really need to understand the genome, that person, the patient as a person or people, their health, related to many factors, environment factors, social factors. So individualized care, sometimes we mean psychological. It's not only psychological and social, it's the genomic or omic too. It merges the world of natural, applied, and human science into a multi-dimensional lens that explores new and better ways to deliver health service. And I think I like this because it merge mean, mix, integrated. Okay. It integrated the world of natural, applied, and human science into multi-dimensional lens, not a single lens. Okay. That explore new and better ways to deliver health service. So, a vision of nursing science, individual and caregiver have a high quality of life in spite of chronic illness. People learning better way to keep themselves healthy and better manage their own health. To have a better fundamental understanding of symptoms such as fatigue, disordered sleep, and pain. Why these three symptoms were mentioned? Because many chronic illness and many, I think, not chronic illness, when people get older, they experience these symptoms. People with advanced illness receive the palliative care they need. Nursing science must be vigilant to looking toward the future to identify area of science where we can continue to make major contribution to health and the research enterprise. So it's not static, okay? Our vision need to be changed according to the change of, of the society, of the technology. Science is not static. That new advance or urgent new challenge can sometimes require to change course. If it's static, it's a dogma, okay? We don't have to do research anymore. It's not static. Because we build theory, we build knowledge based on industry mostly. The field of nursing science must continue to move forward to meet the important health challenge of our society. The foundation is in place for nursing science to make remarkable strides in areas such as symptom science, caregiving, research, and the science of palliative and end-of-life care. This is right now we emphasize to conduct research in this area. We must continue to recognize that Nurses and nursing scientists are at the forefront of the patient's experience, and we are in the best position to study, understand, and improve the life of patients and caregivers. We must communicate the result and impact of nursing science to ensure that the result of our study reach the border of community and inform practice. We build knowledge for the sake of improved quality of life of people. We want to improve our practice. Okay, so we have to inform the community about the knowledge that we found in a simple way. And the aim of nursing science to develop nursing theory with the purpose to describe, explain, predict, and control the phenomena that usually you use quantitative method, and to understand human beings and their experience that usually we use qualitative method. Focus on applied related knowledge to meet some human needs, not only generate knowledge for the sake of knowledge. So the aim of nursing research to build knowledge or nursing science or theories, to promote healthy living, management during illness and recovery, reduction of risks for disease and disability, enhance the quality of life for those with chronic illness, and care of the individual at the end of life. We want to build the theory, or the knowledge about in these areas. And nursing research, we use quantitative, we use qualitative, and now we use mixed method, okay, both qualitative and quantitative. Okay. So that's what I try to communicate, the idea of science and nursing science, and try to relate those knowledge and the method of both ontology and epistemology of our discipline based on Kapler's work, so that you can see that Kapler's work is the original. She laid the foundation of our epistemology and ontology, and then we keep develop progress. So we need to really see the progress, measuring the progress in our disciplines, where we are now. And in the process of progress, there are theories that explain about the progress, whether it is a revolution or evolution or integration. The first one, do we progress through revolution? Revolution means sudden, radical, or complete change, characterized by overthrowing fundamental change. Okay. When you look at our disciplines from the beginning of Florence Nightingale, her theory is the environmental theories. And next, those people, Henderson, who define nursing goal. And you can see that there are many nursing theories, Glenn theory, mid-range theory. Do you think our science progressed through revolution, sudden change, radical or complete change, characterized by showing fundamental change. For example, do we throw away Florence Nightingale theory of nursing theory, environment theory? Do we throw away her theory? Or do we throw away needs theory school of thought or interaction school of thought? Do we throw away those knowledge? This is my question. You need to answer. Someone? Tell your thought. All those theories are still there. It's not like a Kuhn paradigm shift. For Kuhn paradigm shift, you throw away the original theory and then you go into another paradigm, that paradigm shift. And the example is the theory of heliocentric, whatever the terminology, the theory of the sun is the center of the universe, and the theory of the earth is the center of the universe. First one, the first original is the earth is the center of the universe. The God built the earth. Why? The God built the earth to move around the sun. This is come from the religious, right? So the theory is the earth is the center of the universe. And come those scientists, famous scientists, for example, Copernicus, Galileo, and Copernicus and Galileo. Galileo, when he observed, see, he is a scientist, he observed the sky. And what he even made the telescope. This I think he is very famous and is the example of a very hard scientist, hard science. He used telescope and observed, and he saw the planet, the sky, move back. And when calculate, they use calculation that didn't fit with the theory of the earth as the center of the universe. Then come to Copernicus. He is, I think he's a mathematics. He used mathematics. And if he put the sun at the center of the universe, that's the empirical evidence fit with the theory. So they changed that the revolution. They changed to Earth is the center of the universe, to the sun is the center of the universe. But it took 100 years to really wrote his theory, because it's opposite to the religious. And in those days, the tension between scientists and religious, there is a tension about that. So when he died, his work was published. That they throw away the original theory and then use another theory. And when people use the new theory, they are researching, conducting research, right? Under that theory, try to calculate many things, and they found many excellent things that is the basis for technology. However, you can see that we talk about the theory of the sun is the center of the universe. Do anyone see that? Do anyone see the world is moving around the sun with the naked eye. Do people see? Do people see the universe that composed of many planets? So you just see it on the movie or YouTube. How did that was construct the theory? How was the theory construct? They construct from the calculation, right? And then they make theory. But no, nobody can see that theory. Okay, even use the telescope, but they just put the evidence, and then see whether that evidence fits with the theory. So you need to really understand what we are doing is the theory is not the truth. It's inductive, okay? They been from the inductive. It's not the truth. But we believe it's the most believable. But it is not ultimate truth. And the work that we are doing is to collect the data, get the evidence to support the theory. And that we are doing, even in individual and family theory. Those people in nursing, they build a theory. And then when we use that theory in research, we find the evidence to support or not support the theory. If the theory was support, we call it, the theory is confirmed. The validity of the theory is confirmed. If the hypothesis that deduced from the theory didn't support the hypothesis, what did the researcher do? What did you do? Not trying to discuss like that your evidence or your data support the hypothesis. You must honest. This is the characteristic of the scientist. You must be honest with the empirical that you have to interpret whether your hypothesis was support. If not support, you have to provide the rationale. But I don't see anyone can reject the theory right away. They try to explain why it is support. For example, the measurement tool, many kind of things. But they never throw away the theory right away. Okay. So come to this point. So our progress in nursing science, do you think we use revolution? No. Many theories are still there. Okay. We never throw the fundamental idea of Florence Nightingale theory of the environment, right? And the theory of the environment is explicit during COVID-19 pandemic. We get back to those, the cleanliness, wash the hand, those kind of things. Keep cleaning the environment. That is the foundation. So our progress is not like physical science. Okay. So we do not progress through revolution. For evolution, for basic principle of Darwin's evolution theory, each discipline contains of its own body of concept, area of concern, methodology, and goal, all of which can change drastically but slowly through mutable process, but definite continuity can be detected. All idea, concept, and methodology are given a chance to compete, to be discussed, and to be weeded out. Only those discovery and innovation fit will flourish and survive from one generation to the next. Do you think we progress through evolution according to Darwin's theory of evolution? Do the theory of Florence Nightingale get changing and better and better? Do interaction theory by Kings is getting better, getting more close to the truth? No, right? We are doing many things. We use theory from other disciplines, from nursing theory disciplines, but our nursing theory is not progress or, change abruptly, change to others. Do you think any theory in our discipline changing from environmental theory of Florence Nightingale? You just saw Florence Nightingale, okay? So, and we keep many theories come in, right? Many theories come in, not just only those theories in the old day. So the theories exist in itself, and we keep, many theories come in, many perspectives, and you can see that, those natural science, human science, and applied science come to be the nature of nursing science. So this is Dr. Mellis. She said that we progress through integration. We integrate many theories, many perspectives into our nursing science discipline. Competing ideas exist simultaneously. Every theory is in there. Nursing deal. Why? Because nursing deal with holistic human being. Paradigmatic pluralism is in an open system. So we progress through integration. And if we look at the level of theory, we progress through level of theory development from grand theories, those grand theory in the 1980s, and then we become the bin theory from grand theory into a mid-range theory. And many of the mid-range theories in our disciplines, those researchers, they built from other theories too, but they conduct research and then they integrate their research to build their own theories. And situational specific theory. See, this is the level. The high level is the grand theory, then mid-range, and then situational specific, very specific to the situation. So, generation of nursing theory. The first generation is, you know about theory of Florence Nightingale, Johnson, Henderson, Levine, Orem, and many people. Okay, this is the first generation. The second generation, King, Newman, Pace, Roy, okay. And the third generation. The third generation, they talk about how to develop the theory. Not the theory itself, but the method. How to develop the theory, the philosophy of our discipline, our nursing science. And the fourth generation is mid-range theory. And these are the examples. For the first and second generation, the image of nursing in 1950 to 1970, grand theory. Mostly, they been the grand theory. It's high abstract because they try to explain all phenomena in nursing. So it's very high abstract. See, the high abstract have more power to explain all things, all phenomena in the field. Okay. For example, Florence Nightingale theory. I think Florence Nightingale theory, maybe Hamilton Rain theory. Or, those Orange theory or King's theory. I think those theory at the first generation, they base their need school of thought. That's the foundation of the theory. And you can see that we teach students on Maslow needs. That's to explain why people need nursing. Okay? And we call that need school of thought. And the second is interaction school of thought. The third is system theory school of thought. And the fourth is caring school of thought. The need school of thought emerged from what do nurses do? And the answer is nurses are meeting human needs. You remember what we did? Even in the school, the first nursing lab that we did is what? Skill. You must learn the skills. You bed bath, right? I think in the old day, I don't know right now, but in the old day, usually in the nursing lab, we need to do bed bath. That's we are meeting the human needs of the basic hygiene. Okay? And there are a hierarchy of needs. And nurses help the client to meet the needs. And this is the theory of Florence Nightingale, environmental theory. Florence Nightingale is not just the lady with the lamp. She made nursing as a science. Florence Nightingale theory, the philosophy and teaching emphasize that nurses must use the brain, heart, and head to create a healing environment, to care for the patient's body, mind, and spirit. So I think, her philosophy and teaching, really, it's a great theory, not middle, even though she talked about the environment. But this phenomena is cover the field of nursing. Every specialty in nursing look at the adult nursing, psychiatric nursing, even community health nursing. But she talk about, the create healing environment to care for the patient's body, mind, and spirit. Not just only the body, but the mind and the spirit. Nursing since the time of Nightingale has been building the holistic paradigm in all schools of thought with a view of humanistic approach to human beings in their indivisible relationship with the environment. She contributes to holistic critical thinking in nursing. In her environmental theory, is based on 5 points, which she believed to be essential to obtain a healthy home, such as clean water and air, basic sanitation, cleanliness, and light, as she believed that a healthy environment was fundamental of healing. And these are, the theories in the Need School of Thought. Orange, Dr. Henderson, Dr. Abdallah. So the image of nursing in Needs school of thought is active doing for and doing with the patients, and try to increase patients' or client self-care abilities. Dr. Henderson is the first one who gave the definition and scope of nursing. This is what she said. She was invited by ICN, International Council of Nurses, to define nursing. And her belief, it is self-evident that an occupation, especially a profession whose service affects human life, must define its function. See, if we don't have any definition of nursing, we really don't know what we are going to do. We do everything. Even sometimes it's not in the scope of our nursing. And we cannot call what we are doing. Nurses are busy in doing things, but if they don't have any theory to call it, that's, if you don't have concept or theory, that's very vague. We cannot communicate each other. So this is the first definition of nursing in 1995. The definition of nursing, the unique function of the nurse, is to assist the individual, sick or well, in the performance of those activities, contributing to health or its recovery or to peaceful death, that he would perform unaided if he had the necessary strength, will, or knowledge, and to do this in such a way as to help him gain independence as rapidly as possible. So, when you see this definition, you can understand why we keep doing things very busy. Because the patients not have the strength, not have the knowledge to perform by themselves when they are sick. That's why we need to do that. And if you look at her theory, this is what she wrote about the nature of nursing. And Henderson proposed 14 needs as applied to Maslow's hierarchy of needs. She developed her theory and draw upon Maslow's hierarchy of needs. And this is, you can see that nurses keep doing this. These 14 needs. So when nursing diagnosis, we diagnose the needs. Nursing fulfill the needs of people because they cannot do by themselves. The other needs school of thought is self-care theory by Orim, which she proposed the 7 major concepts. But those concepts are interrelated. And the question of Orim is why people need nursing care. And she said, this is very important. If we are in the service and we cannot inform the public why people need nursing care, we cannot really stand up as a profession. Okay? She said that people need nursing care when they have self-care deficit. And self-care deficit exists because the self-care agency cannot meet the self-care demands. And why? Because many condition factors that affect the self-care agency, such as health problems, the mobility, the cognitive function, those kind of things. Many conditions that affect self-care agency. And people, they have demand when they get sick, or even in the normal lay person, they have self-care demand to meet those needs. She called it universal self-care requirement, which relatively like needs. And these are the conditions that affect self-care demand. When people get sick, they have more self-care demand that related to their health, the treatment of the medication that was prescribed, many things that create the self-care demand. So their self-care agency cannot meet the demand. So people have self-care deficit, and nursing must exercise nursing agency to increase self-care agency, or if we cannot increase it, we need to meet by nurses agency. Okay. And nursing agency, the method of helping is teaching, guiding, doing with, for example. Okay. And they must create the design or nursing design system to help these patients. And ultimately, or the goal is to increase their self-care agency. That's the need school of thought. The interaction school of thought emerges from how do nurses do whatever they do. So it's very complement each other. And the answer is the interaction process or nurse-patient relationship. Whatever we do, this is how we do it. When we give the injection, we need the interaction with the patients. So interaction school of thought emphasize on participation, human value. That means that we see human value. We do not override. Okay. So emphasize on people or patient participation, and these are theories in this school of thought. Okay, this is the name and King's. I think King's theory of goal attainment was used in research quite a lot, because I saw a systematic review and meta-analysis using King's theory of goal attainment. Okay. To let the patients and the family participate in their own care. Okay. Dr. Peplau is a psychiatric nurse, faculty member. And her theory is the nurse-patient relationship. Nurse-patient relationship is the therapeutic healer. Okay. So the image of nurse in this school of thought is provide counseling, guiding, teaching, helping patients find meaning in their situations. And this is the King's theory of goal attainment. A system theory school of thought emerges from why of nursing care. And the goal of nursing care is to help the person to adapt with health and illness. It's based on system theory. Every part is interrelated, and the whole is greater than the part. It is in the holistic view. Human is a biopsychosocial and spiritual being. Okay. And the fourth school of thought is caring school of thought. Nurses is a therapeutic healer. Understand people experience, caring, behavior, compassion, and the theories are, Watson, Lineage. These are all those in the category of caring school of thought. And you know about her theory, Dr. Lineage theory and Dr. Watson theory, caring theory. Now, the third generation is meta theories. These are the name of those meta theories. And these are their knowledge or their books on those meta theories. They talk about philosophy underpinning knowledge development. In the old day, we used just only quantitative method and must be consistently with hard science, with other science. Okay. But now, when we really examine our philosophy, and it keeps changing. And I think from Dr. Carper and the progress of qualitative method, which nurses study in other fields, they bring it back to our nursing. So we are talking about philosophy, nursing science philosophy, which I think we do in this class, how to develop theory, criteria to evaluate nursing theory. The fourth generation is middle range theory, present a partial view of nursing reality. Middle range theory are less abstract and address more specific phenomena than the grand theories do. Can be directly applied to practice or theory-based intervention. When you conduct intervention research, it really needs the theory. You cannot really, conduct your intervention without explanation why your intervention, that is the cause, and the effect is the outcome. Very difficult. If you don't have any theory at all, how can you explain why relationship? Okay. Maybe I can give you the example of some manuscript that I received. Sometimes they don't have theory, and they use very concrete term in explaining their intervention. The paper that I try them to read more about whether there is an existing nursing theory that can define positive information. If you think that the effect of positive information on something, what is positive information for? Why you need a positive information? You have to explain it, not just only positive information, and then invited three people who experience that disease to come and give the positive information. Positive information is a very concrete. You have to really put that concrete information to the existing theory that nurses have in our field. Why don't you go and read hope theory? You are building the hope, is that right? For the cancer patient. And see, some people, they really don't understand. I think it's a must, maybe it's the works of master student. But, I told them that I won't publish the nursing intervention without any theory. And I think you really have to be well-rounded with existing nursing knowledge. Okay, that's very important. Otherwise, you are going to be reveal the cycle that within theory. In philosophy of science, the theory is not an ultimate truth, but it's the best available knowledge that we have at this moment. So we need to refine, to get the evidence to support or not support theory, or to define, to refine the theory. And some may use qualitative method to build theory by themselves, of their own, but that theory is, the purpose is to understand it. A very small theory, specific theory, okay? So there are many in nursing right now, I think. And it can directly apply. But you build in research, you build your intervention based on theory and literature review. Don't forget literature review. You may modify that theory from literature review or add something that theory doesn't have, that the previous finding informed that there is some variable that is very important to yield the desirable effect, or can be developed from trend theory or inductively from research finding or systematic review and meta-analysis. You can develop the theories, but you use the evidence of the previous study to build your theories. But remember, your theory is tentative and need to be tested in the empirical world. But I think for systematic review and meta-analysis right now, I don't see any nursing theory that in Thailand, that was developed from our finding right now. But some specific situational specific theories that Dr. Mellis proposed, I saw it in the specific theories, situational specific theory book. Okay, I don't know whether you have that book. Okay. Some we develop from nursing theory combined with theory from other disciplines. These are an example of middle range theories. Usually, master student, they read this theory to apply into their practice, and they use combined with the research finding or evidence-based practice. These are the names of those people who develop middle range theory. These are the examples. Health promoting behavior, individual and family self-management theory, theory of uncertainty, transitional theory, symptom management theory. This is just for the example. And these people that they develop using theory from other disciplines combined with their research. And then, they expand and make it specific to our disciplines. This is the example. But this theory, I think Dr. Gray further developed the individual and family self-management theory. And this is the theory by Ryan. See, this theory tries to explain how we can get the outcome. What factors that influence the outcome in chronic, especially in chronic illness. This theory usually used in chronic illness. And see, there are many factors that influence the outcome. And her theory, even though she derived from her research, but this is just only the theory. So we need to test it. Even the causal relationship among these variables, or building the intervention of individual and family, you have to manipulate this variable for the intervention to get the proximal outcome and distal outcome. Okay, this is the mid-range theory. Now, Mellis talking about integration, the fifth generation of our discipline. We integrate theory in all components of the discipline. Is in developing theory from multiple sources and diverse research. So we can develop the theory from our research. If you want to develop your theories, you conduct the research not just only one research. You need to really conduct research for the the same phenomena, to see it every aspect, to find it where every aspect, and review other study too, so that you can build your own theories, and that theory will be tested against empirical evidence. This is the process of scientific or basic science. Okay. Integration knowledge driven by theories, using integrated knowledge to update, refute, or support existing theory. Integrate research to develop theories. So in my view, doing research, you must have a theory. Not just only review literature. Look at the theories that are existed in our discipline and in other disciplines that related to your phenomena of interest. Going beyond developing concept, not just only analysis, concept analysis in your theory development course, that's just the beginning. But it go beyond that concept analysis or synthesis. So in this integration, she talked about situational specific theories that are the theories that focus on specific nursing phenomena that reflect clinical practice and that are limited to specific population or to particular field of practice. So the properties of situational specific theory is low level of abstract, and I think people love it because low level of abstract, it's it can understand easily. It's not vague. Yeah. Specificity of nursing phenomena and specific to the context. Close link to research and practice. Limited generalizability and respecting diversity. And this is the disadvantage of situational specific theory because it's more concrete. It's linked to research and practice that the advantage, but they have a limited generalizability and respecting. At the same time, we respect diversity. Okay. So situational space theory vs other theory. Grand theory is very abstract, very far from practice. Mid-range theory, okay, closer. Practice theory, okay, more broad than situational specific theory. Is more specific context population, but practice of micro or mid-range theory, it can cover that phenomena. For example, pain is a mid-range theory. Oh no, it's a practice theory, and I think it both. I think it's a practice theory, but pain can be the phenomena of many populations. But situational specific should be specific to population. Okay. See the way that they divided the theory. There are many ideas, but this is one from the Melis that she tried to explain about the grand theory, the mid-range theory, practice or micro theory, and the situational specific theory. Okay. The example of the situational specific theory, maintaining hope in transition, critical to the work of honors, or theory of heart failure. The theory of HPV vaccination behavior among Cambodian Americans. very specific. And this is the situation SST theory. The name of the theory is Maintaining Hope in Transition, critical to the work of allness. Okay. So maintaining hope during the transitional period is a critical care. Is the critical to the work of allness. That means that nurses must, know this critical period, and we really have to help people to transition from one period to another period. What is the period of critical change? And these are the elements of maintaining hope in transitional mode. The antecedent factor is individual resources and capability. We have to look at the antecedents to maintain hope of the patients. Physical, social, and psychological attributes, social determinants of health, and the transition. What is the transition from one state to another? For example, being diagnosed with some disease, change of care setting from one setting to another, from hospital to home, from home to hospital, from ICU to the normal ward. The change of care setting, clinical deterioration for those who has chronic illness. Sometimes their situation is deteriorating. So that's a transition, and there are many transitions. And this is the intervention to bring people hope. Give the information, social support, instrumental support, advocacy for self-care support, and the outcome is increased hope, promoting their control of their situation, decrease depression, decrease uncertainty, optimize treatment, and promote quality of life. And I told you about the paper that I think the master student that she designed intervention, and she called it positive information, providing positive information. I think, and she tried to use those Buddha, But however, I told them that you need to really clear what your intervention based on, what knowledge. And, if they are well around with the theories in our discipline, they will know that, positive information is the building hope from my view, I think it's that building hope. And building hope, you provide the information, and that information must be positive information. Okay. If you tell them the negative information, what cancer is going to be in the negative way, that's not motivate, not hope, not building hope. And social support, not just only provide the information, but provide social support, instrumental support. Okay, those kind of things. This is the example of the situational specific theory. You can see that this theory informs what the intervention should be and what the outcome should be looked for. The other is theory of heart failure self-care. This theory comes from Orange Grand theory. And the theory, the major component and sub-component, composed of the major component, situational, process, and action. Okay. And the situation of the person problems person, problem, environment, and process, experience, knowledge, skills, value, and action of the patients. We expect them to self-care maintenance, symptom perception, self-care management. So it's not vague. It's rather clear, okay? Because it's closely linked to the practice, and you can do research. Okay, you can design the intervention, and you know what outcome you want to measure. Okay. Now, I would like to share this, the definition of nursing. I think we know definition of nursing from Dr. Virginia Henderson, who provided the first definition of nursing. But later on, you can see that the definition of nursing informs what nurses do and what we should do research. And those theory, when we do research, sometimes I think we didn't really conduct research much in the NEET school of thought, I think. Because during that time, our discipline is not really progressing right now. We didn't even have a baccalaureate degree or master degree. But right now, look what we have. And, the knowledge building, there are many nursing theory in our discipline. And nurses do a lot of things. The scope of nursing do a lot of things. When I look at this, at the first glance, I think, oh, it's very difficult. It's very difficult. It's very broad. But when I saw, the process of defining our nursing, I think this is a literature review. They review and they synthesize this very rigorously from the literature and from what nurses do and from, the progress of our discipline. So look at the definition of nursing, which I think will inform our nursing research too. They said nursing is a profession dedicated to upholding everyone's right to enjoy the highest attainable standard of health through a shared commitment to providing collaborative, culturally safe, people-centered care and service. Nursing acts and advocates for people's equitable access to health and healthcare and safe, sustainable environment. The practice of nursing embodies the philosophy and value of the profession in providing professional care in the most personal health-related aspect of people's lives. Nursing promotes health, protects safety and continuity of care, and manages and leads healthcare organizations and systems. Nursing practice is underpinned by a unique combination of science-based disciplinary knowledge, technical capability, ethical standard, and therapeutic relationship. Nursing is committed to compassion, social justice, and better future for humanity. When you look at the scope of our profession, you can see that, it's really getting evolving, developed, more clearer and broader and broader. Now, they give the definition of nurse. A nurse is a profession who is educated in the scientific knowledge, skill, and philosophy of nursing, and regulate to practice nursing based on established standards of practice and ethical code. Nurses enhance health literacy. Concept of health literacy come here. WHO proposed this concept for healthcare profession to empower people to have health literacy. And health literacy is not just only providing the information. It includes, you have to empower people to know how to find the internet in the knowledge, because now knowledge is everywhere. Sometimes it's a fake news. Okay, so they know how to find knowledge, what to believe, how they can believe in that knowledge related to health, and then apply that knowledge for their own health. So I think this is the work that we really have to do to collaborate with interprofessional. And promotion of health, prevention of illness, protect patient safety, alleviate suffering, facilitate recovery and adaptation, and uphold dignity throughout life and at the end of life. They work autonomously and collaboratively across settings to improve health through advocacy, evidence-informed decision-making, and cultural safety. Therapeutic relationship, nurse provide people-centered care. We talk about this for a long time. Now they put in the definition of nursing and nurse. Nurse provide people-centered care, compassionate, clinical, and social care. Not only clinical care, social care too. Manage service, enhance health system, advance public and population health, and foster safe and sustainable environment. Nurses lead, educate, research, advocate, innovate, and shape policy to improve health outcomes. See, we are very anxious. And I think some of nurses can do this. When we talk about nurse-led, it doesn't mean that leadership. They have a leadership, right? But when we use this, they lead. I think many programs nurse lead in the healthcare system. Okay. You can go and see many activities in the hospital or in the community. Nurse lead in health promotion, many innovative, technology, those kind of things, or even the system that to provide continuity of care. Nurse lead how to provide continuity of care. Okay. And they know how to use the digital technology, those applications to monitor the patients at home, that they can provide counseling by telehealth. That's a continuity of care, and then emphasize in this definition. Further, nurses play a unique role in healthcare for population of all age and in all settings, building trust with individual, family, and community, and gaining valuable insight into people's experience of health and illness. Building on a foundation of personalized, direct, and social care, nurses advance their capability through ongoing education, research, and exploration of best practice. How do you think about, this scope of nursing and the role of the nurse? How do you think about this? I think many of you might go to ICN, and this was released, I think, at the ICN conference. I didn't go, but I usually follow the progression of the ICN's work. It represents the reality of our nursing practice. See, we did this. I think we did this, but we never put in written to claim of our boundary. However, in this definition, they talk about, ongoing education, research, and exploration of the best practice. And inner scope of practice is defined by their level of education, experience, competency, professional standard, and lawful authority. They play a key role in the coordination, supervision, and delegation of others who may assist in the provision of healthcare. See, I think this definition, they try to explain the scope of our nursing profession and the definition of nurse. But the ongoing education and research is very important. And the level of education and experience is very important. I think we need to really define the level of nursing practice, because I think the scope is very broad. And I think nurses at the baccalaureate level alone cannot meet this requirement. Even master degree, we need a doctoral degree too. We need the clinical expertise. Okay, and this will inform, what kinds of knowledge that we have to explore in order for our practice to base on. Okay, so now look at the role of theory or model in research. In doing research, we test hypotheses, and the hypothesis deduced from the existing theories. Whatever a theory factor explaining the phenomena of interest, whether it's a factor explaining the phenomena of interest. You select the variables from the clinical observation, and then you have to think about what theories that can inform these phenomena. If you cannot find any theories, but be sure you are well around. You can use theory from other disciplines, plus review literature. Okay. If you do the intervention, you testing of theory-based intervention. And I saw many researchers use self-efficacy theory, motivation, interview. For what? And this theory for, change their behavior. But you need the health science knowledge to be based on what to do. See, I think nursing science is a biobehavior science. This is very clear. And even for the outcome, we try to measure, all those holistic views. Okay, the purpose of theory and research. Theory and research are linked, and your framework is the link between the theory and research. So theory to guide research and practice, and research to build theory and refine. To build the theory or refine the theory. So You have theory and literature review. And you are going to conduct research. You need the framework of the study to link the theory and previous study. In the absence of formal theory, if you don't find any theory that explains your phenomena of interest, okay, you may weave together the findings from prior study into a conceptual scheme that provides methodological and conceptual direction to the inquiry. That means theory synthesis. Theory synthesis. That is one of the theory development methods. Okay. But be sure that you are well around with the theory. Okay. And you can use this combined with the existing theory. This is the quantitative method. Or you use systematic review, but you have to put the linkage between the variables. Usually systematic review for publication, they try to find, for example, if they use the correlational study, they found the relationship among the variables. If they use the intervention for systematic, they will find whether the intervention works. But you have to put it together in your own framework and not repeat it with what have already known. Qualitative research develop theory from the qualitative data. What is the purpose of theory finding and how we can use this knowledge? For example, compassion, individual like care, empathy, and caring behavior, or the art or soft skills. So how can you use qualitative research in your study? I think there are many qualitative research. Even in Thailand. How can you use qualitative research in develop theory from the qualitative data? Because qualitative research, that purpose is to understanding, right? To understanding people experience, to understand their needs, their cognition, their perception. And this knowledge, when you use it in clinical practice, the manifestation of the nurse behavior is compassion, individual-like care, empathy, caring behavior. Okay. So, do you think that you can use qualitative study to build a nursing intervention? Those kind of knowledge. See, for the theory, we use theory. We know the variable or the concept in the theory, and we use those concepts. We select those concepts and to test the theory. Remember, test the theory. Theory isn't taught. We are going to find the evidence to support or refine the theories. Okay. But we use that theory to design the intervention. Okay. How about qualitative research? How can we use this in conducting research? Have you ever used qualitative study to inform your intervention? That's a combined method. And I think probably you can go and look at those qualitative studies and see whether you can use those qualitative studies for your research, for conducting your research using quantitative theory to describe, explain, predict, and control. So that's come, to the combination of those quantitative and qualitative. It depends, we call it mixed method, but it depends on, the sequence of method that you use. Some people, they use sequential, doing qualitative first to find, those problem, meaning, those kind of things. And then quantitative. And some, they use it simultaneously. Okay? And now I saw those people using qualitative research to build the intervention. For example, they use qualitative to explore the problems, the needs of adolescent pregnant. And they know the problem and the needs of those young girls. And they build the intervention. From that, they build intervention, a part of it. But that means that they think that those findings can be generalized, right? See, this is sometimes people think that qualitative cannot be generalized. But sometimes, we just pick up that knowledge and, create the intervention, a part of the intervention that reflect the needs of this group of women. And we need to use health science anyway, right? The pregnant, the pathophysiology, complication of pregnant among adolescents, that's the health science knowledge. But they must decide the intervention according to the needs. But that needs must be consistently with health science knowledge. So they combine. So that's the mixed method right now. It's really nurse scholars use a lot. Okay, and some of doctoral students, they are very high level of their expectation. They do both. Okay. So now, I think the current trend of nursing research across, this is the study about current trend in nursing research across five countries: United States, South Korea, Taiwan, Japan, and Hong Kong. Okay, but not include our country. Various change of current nursing research direction, increased diversity and globalization, technology innovation. Right now, nurse researchers use a lot of digital technology, especially telehealth. those applications. Individualized personal care and population health. Health policy and regulation. Increasing interdisciplinary collaboration. Nursing workforce change. So these are the trends. Okay. For example, wellness, promoting of health and prevention of illness, symptom science, self-management science, omic and microbiome, end of life and palliative care, the science of compassion. So the omic area is the weakness, I think, even in Thailand. Okay. Omic refer to genetic or proteomic and microbiomic area related to precision health, precision medicine. The area that most nurses have little knowledge is playing a large role in advanced understanding of symptom science and end-of-life self-management and health behavior. Personalized health coaching, how a normal sleep pattern and high energy time can dictate when exercise is most effective. We never generate research questions, something like this. But this is because of the omic, the progression of the genomic area. Maybe sleep pattern and high energy time can dictate when exercise is most effective for diabetic patients, for any population. We never see something like this, but this is what they propose. Genomic interaction of gene, environment, and lifestyle is part of personalized health and health coaching. Improve the understanding of the complex issue and choice underlying palliative and end-of-life care. Different context and culture. Document the best practice and effectiveness of various integrative palliative care models, especially in Asia culture, such as religious-based model, Thai traditional medicine model, home-based care model. Develop and test biobehavior intervention that provide palliative care for chronic illness, individuals across the lifespan and diverse population. Develop and test strategy to minimize the physical and psychological economic burdens and better maintain the health of caregiver, particularly when the person for whom they are caring near the end of life. I think research on caregiver in Thailand, there are a large number of research in this area, but I've never seen the systematic review and meta-analysis on research in this area. Because, when you have the population, the aging population is increasing, I think the burden of the caregiver is a very serious one. Okay. And I think we did a lot of research in this area, but really we have to really look at it and see whether we are doing the same thing, not really expand the knowledge and in-depth of the knowledge that really can be the base for the policy maker to make the decision about the system. I think that this system is very important, and I think nurses keep talking about this system a lot, but really those systems that we are building have to have to really put it together, and develop like the theories, the knowledge that can really use in teaching the student in conducting research. And I think this area is really fall within the focus of nursing disciplines. Health innovation develop a new technology to facilitate decision support, self-esteem, and access to healthcare. And I think AI, artificial intelligence, that's coming. And it is going to be the pillar of the healthcare system in the future. So I think the AI may help us in the shortage of nurse, because there are many routine works that the AI can do, or those guidelines. We can generate guidelines from the existing data, and those guidelines probably we can use those guidelines to guide the patients and family, and to guide the practical nurse, the healthcare, the caregiver, for example. So talking about nursing shortage, I think with the health innovation, there are a lot of things that nurses can do in this area. Okay. Nursing, health innovation, e-science or big data. Okay. Include informatic technology and subtopics such as data security and bioethics. The other is implementation science. Evidence result from nursing research is only as useful as the ability to implement the evidence into practice. Remember, we integrate hard science, applied science, and human science. And our purpose of nursing science, we build knowledge to use it in practice. So there are many evidence. We have to use those evidence into practice. And there is a knowledge of implementation of knowledge or of evidence to practice. And in Thailand, that we have an advanced practitioners, and I think this will be the main job of advanced practitioners. Much of nursing research is focused on the narrow testing of intervention and measuring outcome in select population, sometimes, but not always in multi-site study. And I think this is the painful point of nursing research. We do a small study in one situation. We never conduct multiple setting study to see whether this kind of intervention will work and what factor that influence the application of knowledge into practice. The gap between knowledge and practice is well documented, and both action research and implementation science seek to address this gap. See, when people conduct action research, sometimes it's too long to publish, but you can conduct in your protocol or in your project. You can separate the publication if it's too long. Okay. Okay. This is in the United States. The doctor of nursing practice, they prepare nurse who can position to apply the evidence into practice. And in Thailand, we have certified board program in advanced nursing practice. But you, as a PhD, you need to build new knowledge for our nursing science. Okay. Is this another area, team science? learn the team science technique necessary to study complex phenomena. When you're doing research in the future, your research is going to be used if you collaborate with other disciplines to really look at more comprehensive phenomena. For example, social determinants of health. Health based on many social determinations, which cannot study by only profession. So team science working together is very important, or even working in the clinical area. The test the effectiveness of using team approach to improve, quality of life, reduce cost of care, people access to healthcare, those kind of things. So interdisciplinary class and experiential learning in laboratories of other scientists. Okay. Ramathibodi School of Nursing is building the curriculum, PhD curriculum, admit the student from baccalaureate degree toward the PhD, and they are going to produce the nurse scientists who can do research in the omic area, which I told you that it's an area that nurses have little knowledge, but it's progressing, and we are going to collaborate with the university in the United States that they conduct this kind of research. And I think that will, help our nursing science to really keep up with the progress of scientific knowledge. Funding, developing grant writing skill, I think you need to learn it in the PhD program. Okay. If we look at the progress in nursing knowledge development, and these are the criteria. New national and international journal. You need to look at the journal, whether we have journal to publish, or even other journal do nurses publish in the national and international journal. And I think in Thailand, I know in Thailand, but I don't know, in your country, foreign student country, but in Thailand, I think we make a progress a lot. We have the journal, both in Thai and English. And I think we have this journal, we can have this journal because of graduate program, both master and doctoral program. Because I saw that most of the work of the paper come from these students and faculties. Now, in Thailand, there are about 50 journals in nursing. Okay. The PhD, we have PhD program plus postdoctoral education. I think for postdoctoral education, the faculty must have a very strong research project going on and receiving funds from outside the university. And if you have a good research project, then you can admit postdoctoral fellowship. Publication in peer review and interdisciplinary journal. Okay. I think we have that in Thailand. Development of research center, especially in the university or faculty of nursing. But I would like to see research center in the hospital or in clinical practice too. National research priority in nursing. Okay. Thailand Nursing Midwifery Council they organize the conference on research, international and national. And every 4 years, they have a position of the direction of nursing research priority. Establish a research unit of nursing in the hospital. Okay, that I talk about that. Appointment of associate dean and director of research in School of Nursing. Okay. I think doctoral program or in those schools that have doctoral program should have associate dean and director of research. So may I end up with the purpose of PhD program to prepare nurse scientists who will advance knowledge, nursing science, theories in nursing disciplines. The program must design to rigorously provide theoretical, methodological, and contents expertise. The contribution of nursing science to the healthy people in 2030 will be evident and contribute to development new theory, refinement, expansion, the existing theories. So that's what I share with you today. Any questions? And this is our journal, Pacific Rim International Journal of Nursing Research. This journal was established because of the doctoral students. But right now, many of the master students, they publish in this journal too, but they need a strong theoretical perspective, okay, and rigorous methodology. If the methodology is weak, that research cannot be included in systematic review, okay? And that waste of time. So you really need both theoretical literature review to form a strong foundation of your conceptual framework in the study and use rigorous method to answer the research questions. Okay.